Hi guys, how are you guys doing? So for today's video, I'm gonna go ahead and show you guys different types of restraints and also how to hook up a patient to a restraint. So the different ones that we do have, we have the mittens. The mittens is probably the least restrictive type of restraints that we do have. These are for maybe like the older patients that keep pulling on their IV lines. They're a little bit confused. So this is an appropriate restraint. We also have the soft wrist, which looks like this. This is a soft wrist restraint. We also use it as soft ankle restraint as well. So that's the second type. The third type of restraints that we do have a vest. They may come in different, they may look a little bit differently based on the brand, but we do have a vest restraint as well, and I'll go into the why it's different and what is expected from them. And we also have this type of restraint as well. This one is more like for those patients that are a little bit more violent. This is the twice tough cuff. So we do have these type of restraints where you will need a key to open it and close it as well, okay? So what is the difference between all of these restraints? So the vest, the mittens, as long as it is untied, and also we have the wrist restraints and the soft wrist. All of these will be considered as non-violent types of restraints. These are for the patient. They're not necessarily violent, but maybe they're confused and they do need the restraints so they don't hurt themselves. This type of restraints that we do have, this will consider more of a violent type of restraint. These are the patients that are a little bit more combative, and of course that's going to come with more documentation as well, okay? So the difference between what we will consider a violent versus a non-violent type of restraints is the documentation. Patients that are more violent, they will probably require documentation, maybe like every 15 minutes based on your hospital policy. And those that, do not require violent types of restraints, that's probably going to be every 2 hours, maybe if they're, they're tied, or every 8 hours for those mittens, but of course follow your hospital policy, okay? So one thing about applying the mittens, just make sure that when you are applying mittens, of course you're gonna need the physician orders. Those orders are typically good for 24 hours, but like I said, do follow your hospital policy. So once you are putting on the restraints, one of the things that we wanna make sure is that the patient's hand is not bent, okay? So we always wanna make sure that we are leaving a little room for their fingers, that they're not hurt. And when we are putting it on, we just also have to make sure that we are able to put 2 fingers in between, just to make sure that it is not too tight on the patients. Any type of restraints that you put on someone, you want to make sure that you're constantly evaluating the patient, that you're checking their circulation and all that good stuff. So this will be your mittens. The second type of restraints, the soft wrist. This one will require a little bit more documentation because it is tied, probably like every 2 hours. So for this type of restraints, put this on. Just going to put it around the waist. And once it is on, the same process, you want to make sure there's 2 fingers that's able to go through. Once you put it on the patient, it's a little bit harder because I'm doing it on myself. But once it is on and we are able to tie it in the bed, just make sure that anytime that you are retying on a restraint, that you are putting it on a hook. So it's gonna be through here. We never want to apply the restraint on a movable place. So you wanna make sure that the patient is safe. We have these hooks over here in the bed where we are able to tie the restraints. So when we are tying it, it is called a slip tie knot. So the way that you will do a slip knot is you will go ahead and grab your restraints, then you go ahead and pretty much just wrap it around your hands, and then you bring them through the loop, and that should be nice and secure for someone that's in the bed. This is what is called a slip knot, okay? Because it's easy for us to be able to just go ahead and release the patient if needed. So That's why the slip knot is there for, okay? So you can do it on this hook, and for the legs, you're able to do it on this side as well, okay? So this is the soft wrist and soft ankle restraint. The other one that we do have is your vest. So one thing about these vest restraints, sometimes they do come with extra cords that we're able to tie the top. Just be mindful of your hospital protocol. It could be a hazard for a patient. If they go down, they may choke themselves. So just make sure that when you're putting it on, you are looking for the exact size, an appropriate size for the patient, because if it is too big, then that's an easy way for patients to get out of restraints. So you want to make sure that they're comfortable. So once you put on the restraints, you're just gonna make sure that it is zipped. So it's the back, nice and stiff. Once that is zipped and it is comfortable, it's a good size for the patient, then you're going to be able to attach the hooks, the strings, which is are on each side, to the areas here where we do tie restraints, okay? So this is where you would tie. Just make sure that we're not crisscrossing in the back with this type of brand, that we're putting each of them towards the side. All right, guys, so thank you. Those are the different types of restraints that we had. I love you. Just remember that, you know, the world needs exactly what you have. So just go after your dreams, all right? Love you guys.